My presentation today will focus on psychosocial rehabilitation, and the model that I will be discussing today will be the clubhouse model. The problem. Schizophrenia and schizophrenia spectrum disorders can be a debilitating illness if not managed effectively. These disorders have been and continue to be a key focus of the work of mental health care services. Individuals suffering from schizophrenia spectrum disorder can have severe social incompetence lasting throughout their lifetime. Disability prevalence can reach up to 40%. Social disabilities can be evident in all spheres of life, but are not limited to the following: education, employment, interpersonal relationship, self-care skills. Prolonged hospital inpatient can also lead to social incompetence. Impaired social functioning encompasses both neurocognitive and social deficits. Proposed practice change. There is a need to incorporate essential use of therapy targeting the key determinants of social functional deficits. This is because improving social functioning solely by control of the psychotic symptoms using medication alone is not adequate. According to Govridge et al., the four key determinants of social functioning are: 1. Theory of mind, which is the ability to understand another person's mental state and or draw conclusions about their intentions. 2. Attributional style. This is how one explains to oneself the cause of positive and negative events in one's life. 3. Emotional intelligence, which can be emotional perception, emotional recognition, and emotional management. And 4 is going to be social knowledge, which is the comprehension of social situations. Psychosocial rehabilitation is used as an adjunct to the use of pharmacological interventions. This is a form of recovery that uses targeted programs either in a group setting or individual setting to help individuals suffering from schizophrenia and other mental illnesses build abilities to interact, solve problems, and employ coping strategies that were lost or have not been formed due to their illness. Clubhouse model is one of the widely used group psychosocial rehabilitation that is used today. Clubhouse is a model under the umbrella of Clubhouse International. There are over 335 clubhouses globally, about 202 in North America, 80 in Europe, and the rest in other parts of the world since 2012. Clubhouses differ from most rehabilitation programs because the program is based on the principle of empowerment and recovery. Clubhouses are co-managed between the staff and members, have peer help instruction, and no medical personnel as a staff. Clubhouses offer a range of activities and support, including social and recreational events, and aid in accessing education, employment, and housing. According to Bagel et al. 2013, they concluded the following: Clubhouse members with peer network significantly had more frequent contacts with peers than with non-peers and were more satisfied with the relationship with their peers than the relationship with non-peers. Peers were significantly less critical than non-peers. Caucasian clubhouse members were found to be more likely to indicate the presence of peer support than club members from minority reference groups. Clubhouse environment promotes unity throughout membership, thus facilitating a sense of community within the whole system of the clubhouse. According to Burton, Bovet, and Hatara 2016, which had a systematic study of 16 research studies in terms of the effectiveness of the clubhouses, showed moderate effectiveness for increased quality of life, increased employment, and decreased rate of hospitalization. Mushler, Rose, Maxine, and Herbal Brack's 2018 showed that realistic theory of psychosocial rehabilitation to conclude that clubhouses promote recovery for their members. Recommendations. Self-determination theory, which is a framework for recovery paradigm, can be a useful tool to determine how service and design of the service environments can lead to optimization for recovery and well-being of members. The use of the realistic evaluation supports the fact that this particular clubhouse, known as the Promise House, promoted recovery for members, and that the use of the multifaceted holistic perspective on recovery should be encouraged at all times. There were moderate levels of effectiveness in terms of quality of life, employment, rate of hospitalizations, and low levels of effectiveness for social functioning. However, the researchers noted that some of the studies compared were inadequate due to lack of comparison group, absence of a longitudinal design, and adequate randomization. Implications for practice. Members are working together to promote unity and sense of accomplishment. Members feel better and are at peace with themselves in terms of reduced stigma, dignity, reduced isolation, and relationship to others. Members acquire independent skills to live life similar to normal life people have without the illness. Increased compliance on treatment plans and medication regimen. Decrease overall admission rates. And that concludes my presentation, and these are the references. Thank you.